Well, good afternoon, everybody, and Sally said a very warm welcome to everybody to this happy hour session. This is the third in our autumn-winter series. We are moving on from looking at technology and ageing well, which were the themes of our first two sessions, to one which is around what makes healthy cities and what makes those happen. And we've got a really great cast for you, who I'll introduce shortly, but also to say that our Happy Hour series are generously sponsored by the UKRI Healthy Aging Challenge, and we have two beneficiaries of that challenge fund with us this afternoon, who will share information about their projects in Belfast and Scotland respectively. But we're delighted that we can be joined by Lord Best, Richard, who many of you know is the chair of the all-party or co-chair of the all-party parliamentary group on housing and care for older people, but a lifelong champion of the happy design principles and a number of issues relating to the care and support of older and vulnerable adults right across the UK. So delighted that you could be here, but importantly, he also chaired the commission on what makes healthy cities, and we are joined by Dr. Juliet Carpenter from the Global Centre on Healthcare and Urbanisation, and her colleague David, who's hidden around somewhere, from the University of Oxford. And they're going to do, I think Lord Best and she are going to do a double act. So I'm going to hand over to Richard first and ask you to give your introduction, and over to you.
Jeremy, thank you very much. But we need to thank the HousingLIN much more than just for today. I mean, the HousingLIN has become part of the absolute essential participation for all of us involved in housing and care for older people. And Jeremy, you've done a fantastic job, you and your colleagues, and we're all very glad to come and participate with you today. Some really good stuff from the HousingLIN. So I chair the all-party parliamentary, co-chair the all-party parliamentary group on housing and care for older people, and this has picked up on the happy themes: housing our aging population, panel for innovation, HAPPI. I will give you the background story. I hope we won't waste too much time with it, but when this first came to me, this lovely acronym hadn't appeared. The HAPPI slogan that we've kind of branded so much on ever since. But the first time round, it was the Panel for Innovation for Specialist and Supported Housing, Older People's Housing, which is PISSOPH. Now that one reads piss off. And we thought piss off wasn't absolutely the best possible title. So we came up with Housing Our Aging Population, Panel for Innovation, HAPPI. And Jeremy's been making good use of this ever since, including today's happy hour. So the sort of special ingredient today in our links between all these different strands is this. Here's my visual presentation. This is our report on what creates healthy cities, the commission on creating healthy cities from the University of Oxford, the team who are going to, thanks to Juliet and David who are up next, we're going to get a detailed appraisal of the things that we've done. I simply chaired that, looked after it, but I did look rather closely at the theme of bringing together the issues of place and the issues of health. Healthy places, healthy homes, healthy transport, healthy eating, all the aspects of the physical environment and what a difference they make to people's individual health. And indeed, if you don't address the underlying causes of ill health by looking at the environment in which people are living, then you never solve the health problems, they just get worse. So the underlying theme is this link. We say for all healthcare professionals, think health, think place. And we say to all those placemakers, we say, yes, think about placemaking, but think place, think health, because that is really the key to how you can bring together these different strands. So the all-party parliamentary group it goes on endlessly about the three legs of the stool: health, care and housing. And we hear a lot about integrating health and care, integrated care systems, integrated care boards, thank goodness that message is coming over loud and clear. Health and care go together, and we need to find the mechanisms that will make that work. But we have not done enough about bringing in housing as well, the physical environment in which people live. And we've said that there are the three legs of the stool: housing, care, and health, all three together. Without one of them, the stool falls over. So in following the work of the Commission on creating healthy cities, I've had a special interest in looking at that link between housing and health and care. And I picked out three little items for us to just contemplate today. Juliet will do the proper job of introducing the formalities of what we actually did and our 20 recommendations. You won't go through all of them, I don't think, Juliet, but we came up with 20 recommendations, and I think I spotted 100 policy tips, policy ideas, ways in which things could be changed for the better. But I'm just going to pull out three because they're my favorites, and they're the ones for today, to do with housing and care for older people. So we all, I think, everyone who tunes into anything to do with the HousingLIN believes that housing is absolutely fundamental, and that the link to health is absolutely central. And if the NHS is to be saved from really pressures that will become increasingly unbearable, we have to get back down the line and cure some of the problems, the underlying causes of ill health, physical and mental ill health. And if we do that, we save the NHS resources, we save those delayed discharges because people can't leave hospital. I see a figure in today's newspapers of people, 13,000 people a day cannot be discharged because their homes cannot accept them back again. They're just not suitable to be released from hospital, which is a fantastically expensive option. If people fill those beds in hospital, the ambulances wait outside, the ambulances are not picking up somebody else who needs care. Doctors are in a state of tension and disruption. The operations get put off. Everything follows from there not being the suitable housing that would keep people safe and enable people to return from hospital, and indeed will prevent the accidents in the home that are so common in the first place, the falls, the difficulties of people getting up and down stairs and down slippery steps outside. So health and housing / care do go together so importantly. And if government is concerned now almost exclusively with growth, well, this is about saving precious resources and preventing the health service really going into a state of collapse when we get to the winter. We have to understand that addressing the housing issues addresses the health issues. And of course, fuel poverty, people being cold in winter, it's housing that's to blame. Sir Michael Marmot, who we quote in the Commission's report, puts housing at the top of his list of reasons why people are unhealthy, why there are extreme health inequalities. I think that the Commission, if we'd known about it, Juliet, we should have joined the I didn't actually know of its existence, but the IHA, which stands for the Alliance on, what does it stand for? It's the Inequalities in Health Alliance of 155 member bodies. And I think we could have been part of that. Health inequalities is absolutely where we're coming from. They say without a clear cross-government focus on the issues that cause ill health, the DHSC and the NHS will be left in the ultimately unsustainable position of trying to treat illness created by the environments people live in. So that could have been our conclusion as well. Just let me give you my three sort of special items from the report for us to take away. First, in order to get the new homes built, we need to change things in the planning world. At the moment, everything favors the house builders putting the maximum number of family homes packed together, the highest density they can get away with on the site. And we're not building new homes for older people, retirement housing, extra care housing, assisted living housing, whole retirement communities. We're not doing it. Something like 8,000 homes a year. At our peak, we got up to, I think, 28,000 homes a year for older people. It has fallen away because it financially has not been sufficiently profitable for the private sector to build. And we need to change that by using the planning system. If the planners demand and require there to be housing for older people, because that's with an aging population, that is the need that is expressed when they do their housing needs assessments, then that insistence is what we need to ensure that the sites can be acquired for this purpose. Either sites allocated specifically, those downtown sites that can regenerate a whole neighborhood in the high street area that could do with something fresh. A new scheme can do so much, but it's going to require the planners to insist that that site is allocated for retirement housing, or with the big schemes that are now quite common from the major volume house builders, require them to have a proportion, say 10%, that is retirement housing, so that it actually happens. So my first point is get the planners on board. Proactive planning is what we need to achieve the vast increase in the number of new homes that we're going to build for older people. My second point is we need a retrofit strategy for existing properties. Those that are owner occupied need home improvement agencies who can come and have a cup of tea and talk about it and organize the works that need to be done to cure the fuel poverty, the cold and damp that otherwise is going to happen if people don't get their heads around how we improve the stock that we've got. We need the home improvement agencies to be vastly better resourced to achieve that. We have 27 million homes in the UK that need to be upgraded to meet climate change responsibilities. There are 27 years to go until 2050. That is 1 million homes a year. Let's get started on that retrofit program. And when it comes to the private rented sector, which is the sector where there's the largest number of homes that are in need of upgrading, retrofitting, when we come to the private rented sector, let's have a fund. We mentioned this in our Creating Healthy Cities report. Let's have a fund that enables the social housing sector, community-based organizations, housing associations, to acquire from the private landlords those rubbishy properties, do them up, and get them into a condition that the occupiers can really appreciate, instead of the poor management and the insecurity that the private rented sector is currently offering those occupiers. So then my second one is we need a retrofit strategy, and it needs to embrace both owner occupiers and private sector tenants. And my third and last little special that I feel strongly about, we've got an inquiry running at the moment. We don't report until December, so I won't steal too much of its thunder, but I think there's some mileage in shared ownership schemes for older people. We have an awful lot of older people whose properties are not worth enough to enable them to right size, to make the move that would be far better for them, much cheaper for them to be somewhere that's got lower maintenance costs, lower heating bills to move, but they can't afford it because there's a gap between what they would get from selling their own house to what it would cost to buy into a retirement scheme. And that is tens of thousands of people. We could open up a much bigger market through shared ownership for older people. This enables me to conclude, Jeremy, with those acronyms again, because shared ownership, housing for an aging population, our panel for innovation that we're now working on, reads so happy. And on that note, I leave you. Thank you.
Richard, that was a very good round off to the opening acronym, and a much better one, I think. And we look forward to promoting the So Happy report, which I also believe is going to be published in Happy Awareness Week. So that's a very good link. But thank you very much for those really wise words and your 3 key points. I know the planners amongst us, and there's several I can see from the participants list, will be some of the words are music to their ears. And I also think for those people who are working in health, I think what you highlighted around health inequality and the link with housing inequity, we need to tackle both, and that integrated piece is key. So thanks ever so for that, and for setting up nicely for Juliet, who's going to join us now. So we've got a couple of questions I think already come through, but we'll address those at the end. So without further ado, can I invite Dr. Juliet Carpenter from not GCHQ, but GCHU at Kellogg Centre at the University of Oxford to share your slides, and we look forward to your presentation. Over to you, Juliet.
Thanks very much, Jeremy, and thank you very much for the invitation to present the results of the report that has been produced by the Commission on Creating Healthy Cities that us at GCHQ have been supporting. So let me just share my slides. There we go. Is that working? So hopefully you can see the right view there. So my name's Juliet Carpenter. I'm a research fellow at GCHU, and I'd like to present today the findings of the report on what creates healthy cities that Lord Best has just been talking about. We at GCHU were supporting the Commission, and it was very much a team effort. I'm joined here on the call by David Howard, who will be helping to answer questions at the end, and also colleagues Georgia Richards, Robert Weavers and Carl Hennigan, who are also all part of the team and part of GCHU. And what I want to do today is to give you a bit of background to the report, to explain what we defined as a healthy city, and then to take you through the four findings, the four headings of the findings from the report, What Creates Healthy Cities. So that relates to the built environment, particularly housing, as well as issues around urban design, transport and mobility, and that included infrastructure and technology, health and well-being, the broad area of health and well-being, exercise and lifestyle, food themes, and good governance, which was an umbrella theme that really encompassed all the other themes as well. And then I'll just conclude with some thoughts on where next for building healthy cities of the future. So just to give you a little bit of the background, which Jeremy and Lord Best have already talked about, this was a collaboration between Oxford University, in particular GCHU, which is based at Kellogg College, and the Prince's Foundation, who've got an interest in sustainable urban development. And the aim of the Commission was to provide evidence-based recommendations to UK city leaders and citizens on improving health and well-being of communities. And it very much was born out of GCHU itself was created in 2019, and quite quickly afterwards the pandemic hit, and it was born out of a reflection of how cities were responding to the pandemic and how cities can contribute to health and well-being of communities moving out of the pandemic in a post-pandemic and sort of future scenarios system. So just to take you through a little bit of the methods that we used, we had an international call for evidence, which we launched last summer, 2021, with a whole range of responses from the public and private sector, from different parts of the UK, Europe and elsewhere, also from the community sector. We also carried out some high-level stakeholder interviews with the WHO, World Economic Forum, OHID, and also ran 4 expert workshops in the themes that we were interested in, to develop the narrative and to develop the evidence and to test out some of the findings that were coming through the call for evidence. And then in parallel, we also carried out a systematic scoping review of evidence. So this was a review of all published academic literature that had been published since the year 2000 up to 2021, searching for literature that related to healthy cities. And we came up with over 1,000 reviews. So we're actually looking for reviews of primary research evidence. We came up with over 1,000 reviews. From those, we screened down to the ones that were obviously most relevant to our work, which is around 260 evidence reviews. And from that, we've been building Healthy Cities Toolkit, which is an online toolkit for policymakers and citizens to explore some of the evidence that's documented in this review. So it's a user-friendly online tool where people can click on particular themes and explore some of the evidence, what it says in terms of the impact of interventions on the quality of the evidence and the resource implications. So that's the Healthy Cities Toolkit. It's very much work in progress still at the moment. It is live, and we can share the link to that. There's a feedback form if you'd like to give us feedback on that as we develop it further going forward to the end of the year. So that was happening in parallel. So what I'm going to be doing is reporting on the evidence that came from the call for evidence and the high-level interviews, plus the expert workshops. And this is the report. I think also it's been put in the chat, a link to where you can download the report, which was published this summer, July 2022. So just to say a few words about what we defined as a healthy city. So as you may well know, the World Health Organization has been running a program on healthy cities for the last 30 or so years, looking at what creates a healthy city, and given their sort of long experience of developing this in partnership with cities, including Belfast, of course, which we'll be hearing from later on this afternoon, we thought it would be wise to take their definition, given that it really highlights the key issues that we ourselves were interested in exploring for what creates healthy cities. And I think what it does as well is really sort of highlights again, what Lord Best was saying earlier, that health and place are inextricably linked. And I think this is one of the key themes running through the report, and one of the key messages that came out of the work, that place supports individuals' health and well-being, and health and well-being can feed into place. So it's that inextricable link, I think, between the two, which is so important. And I think that's one of the sort of key takeaways of the work that we've been doing. And just to show this, which many of you will be familiar with if you work in the area of health in cities, coming from Barton and Grant, and previously from Dalgreen and Whitehead, which really quite nicely summarises the wider determinants of health. Again, Marmot highlighted these in his two reports as well. How in the centre there we have people, we have the, if you like, the immovable aspects of health, which is age, sex, hereditary factors. And then surrounding that, you have the wider issues of local economy, community and lifestyle, but also issues around built environment, natural environment and different activities. And that's where sort of place and a planner's role can really come in terms of the built environment, buildings, places, housing, which you'll see is a key aspect in terms of the wider determinants of health, and all then set within the global ecosystem. And this is also came out very strongly in the report around the links to health and well-being and the win-wins that can be had through investing in health and well-being in cities, and climate change, and addressing some of the sort of climate emergency themes, and reducing carbon emissions, where the two are very closely linked. So I think this is a useful diagram and schema, if you like, to sort of frame the work that we've been doing. So now I just want to briefly go through some of the headlines of the four themes that we were exploring. So here we have built environment, urban design and placemaking, and very much around what Lord Best was talking about in terms of the importance of housing to health, in particular older people's health. So some of the key headlines there are the need for more affordable housing, the importance of housing quality, and we've already heard about how cold and damp housing or poorly ventilated housing can have really important impacts on people's health, energy efficiency and insulation issues, and then the proactive planning that Lord Best was talking about. So this was very much one of the key messages here. And some of the data that came out of the evidence that we reviewed, for example, that top figure, 1.4 billion, that came from Building Research Establishment, who've estimated that there were an average of 3.5 million so-called poor homes in England, those homes that are really in need of renovation, retrofitting in terms of their damp, insulation, cold. And they estimated that if £10 billion were put into these 3.5 million homes, there would be annual savings to the NHS of 1.4 billion per year. So only after 7 years would that initial investment be paid back. I mean, interesting figures that I think the Treasury would it sort of speaks the language of the Treasury, and I think those kinds of figures and data and research I think are really powerful tools in making the case for the importance of investing in housing and place for health and well-being and health budgets. So moving on then to the second theme, which was transport and mobility, infrastructure and technology. So some of these themes will be very familiar to you in terms of reducing car dependency, not only for a health and well-being point of view, but also in terms of air pollution. And data from the Royal College of Physicians has shown that there are 40,000 deaths per year attributable to air pollution in the UK, a huge number of deaths. Largely due to emissions from cars, and then sustainable transport planning. And there's some interesting data as well from Transport for London, their walking action plan, which shows that with just 20 minutes of walking time for every Londoner a day would save 1.6 million in NHS treatment costs. Again, something that I think the Treasury would recognise as an important incentivizer for getting people out and walking more. Then in terms of health, other benefits would be 1.1 in 6 early deaths saved, 10% of strokes and heart disease, 20 to 30% of cases of depression. And again, mental health, I think mental health impacts of some of these changes in cities, I think are really underestimated. And I think it's certainly worth considering the mental health impacts of having a more active travel and active lifestyle in addressing some of the mental health challenges that are growing in cities and elsewhere. So thirdly, we looked at health and well-being, and under this heading, we explored issues around public health, social prescribing, and then food, access to healthy food, and exercise. So again, linking to active travel and being more active in one's daily life. And I think this data is interesting that we've put up here, showing the health inequalities. Again, this is something that Lord Best was talking about, health inequalities, but within cities, and how, for example, living within a 10-minute walk of access to green space, for example. Only 35% of low-income households are within a 10-minute walk of green space, compared to 59% of more affluent households. And so it's addressing these inequalities in access, which can go towards addressing inequalities in health. Similarly for obesity and the inequalities and the health disparities are very evident in terms of obesity, instances of obesity in more and less well-off areas, which links, of course, to access to healthy food. and particularly with the cost of living crisis, when for example, an apple can cost the same as a small packet of biscuits. I think issues around choices that are made when people are facing a cost of living crisis, I think are really, really important. And certainly news around food banks on a daily basis are very worrying signs that people are having less and less access to healthy food as they face this crisis. And so fourthly, around good governance. And so this was an umbrella theme that really touched on all aspects of policy. Firstly, interdepartmental coordination. And we were actually presenting the report to a DLUC seminar, the Levelling Up Ministry department. And we did say, well, it'd be great if we had people from across government coming to the webinar. And they said, well, actually, this is more a sort of departmental webinar. And yes, we might get one or two people from other departments, but probably not. When, fundamentally, this is such a cross-government issue. We were surprised, and perhaps after seeing the presentation, they will think again about trying to involve colleagues in conversations like this, because the importance of interdepartmental coordination is clearly paramount. Then issues around devolution to local government, and civic engagement, so participation, getting people involved. And just to give a quick example of a citizens jury that we've been running in Oxford over the summer called Street Voice, where we involve 16 jurors randomly selected to talk over 4 weekends and deliberate around issues of health, transport and climate change. So it's those kinds of alternative and deliberative democratic processes which I think can be really helpful in a governance agenda around health and well-being. So just quickly to run through some of the evidence from the toolkit. I mean, many of these issues will be familiar to you in the housing sector, but just to reiterate some of the messages that Lord Best was talking about, issues around poor housing and poor health, the links between those, the need for green homes grants for retrofitting, and the impacts of overcrowding, for example, on physical and mental health. So all these are really important issues that came through the toolkit evidence, and that's one of the housing is one of the themes that is already up on the website if you'd like to explore that. So just quickly running through, just to wrap up the key messages, and I think one of the headline messages is the need to embed the strategic aim of improving health and well-being in all urban planning policies, and what we'd argue is that England is really rather lagging behind the two other nations of Wales and Scotland in terms of their approaches to embedding health and well-being within their urban planning and strategic planning tools. And I think we'd argue that England really does need to start thinking more along these lines in terms of health and well-being being fundamental to all policies. And then just the case for addressing health and well-being touches not only on inequalities, it touches on economics and productivity, climate change, and the costs of health and social care. So really, there are very, very good reasons why health and well-being should be underpinning all policies. So what we want to do now, as we've said, is to disseminate these key messages to local authorities, to other stakeholders, central government, and to identify some areas for further research, to really push forward some of these the gaps in the evidence, and to really fill those gaps to make a case for the importance of health and well-being in creating healthy cities. So thank you very much for listening, and looking forward to the discussion and questions afterwards.
Julia, thank you ever so. A really comprehensive presentation, and I think you really distilled it beautifully and made it so clear and simple. Of course, it isn't simple, but thanks ever so. And I know we will come back to many of the issues you raised in the Q&A session shortly. but also it touches on other things that we want to pull out in the next two presentations. So I'm going to invite Anne McCusker to join us first. Apologies if I called you Emma by inadvertently earlier, but Anne, if I didn't, that's great. But Anne, welcome, and I look forward to hearing what's going on in Belfast.
Thank you, Jeremy. I'll just share my slides. Here we go. So I really welcome Juliet's report and or the presentation of it. I think certainly what was presented really aligns with the framework and the ethos of the Healthy Cities Network through WHO, and it's fantastic to have the same calls for the wider determinants of health to be explored and put into policy. So very excited to see what happens next. I'm going to speak briefly about the work of the Healthy Cities Network, and then in Belfast, our interpretation of the framework and the opportunities that we have to work with partners across Belfast. So the WHO network, as Juliet mentioned, has been going since 1988. A real variety and flavour of cities working in the field. It covers 1,400 cities, both designated cities, which are the flagship ones, and then an opportunity for other cities outside that quota to join through their national networks, covering a total of 165 million people across Europe, bigger than the map of Europe, but again, covering 48 states. We're now in phase 7, which runs until 2025. And the framework is largely the same. At the centre is really promoting health and well-being through equity and governance. And the 6 Ps around the outside, they were developed as an interpretation from the Sustainable Development Goals. It was the Copenhagen Consensus of MERS identified a need to work at city level on the SDGs. And I suppose that is the unique quality of the Healthy Cities Network. It's working directly with WHO. It's their only city level programme and pushing forward on emerging public health issues and how they could be interpreted at city level, where most people will live in urban environments by 2050. Our population is ageing. And how do we create the conditions within cities that allow rapid access to healthy conditions to make the healthy choice the easy choice for all of us? So largely a political network. Each city signs up through its highest elected members of the mayor of the city to support the development of the work, and very much a partnership approach. Each city interprets it in the ways that suit the needs of their city. So through our partners, we decided our themes until 2025, and it's promoting healthy transport, green in the city, community prosperity. Certainly one of our key roles is sharing knowledge and information and maximising the learning across Europe. So you can see our partnership covers statutory, academic sector, community and voluntary. And we're very much aligned to the public health strategy in Northern Ireland and the community plan and priorities as well at city level, and link in with government departments. Local government is slightly different here in Northern Ireland. It has responsibility for parks and leisure, for planning, unlike in England and other parts of the UK, where they would also have education and public health that currently sits outside of local authorities here. But our challenges are still the same. So the network are working to look at how our cities can be developed to support ageing populations, certainly the issues of climate change and environmental challenges, and how those can be interpreted and related to people across cities, and how to make it relevant both in practice but also influence in policy change. And of course, inequalities and the cost of living crisis, the change in social challenges is at the fore of everything that we do. And I think COVID-19 has really shone a lens on all of the challenges and who is greatly affected the most when things change. So it is so important to look after our ageing populations, but to also ensure that we take an inequalities focus to the work that we're doing. So thinking about the map that Juliet displayed around, you know, the wider determinants of health and the importance of planning our cities and our communities and how that supports people's health, we certainly look at greening, and our approach to this, it's a new area of work for us during phase 7, and it was really looking at biodiversity and how we can interpret that and build capacity to ensure that it's included. It's certainly an issue that people are concerned about, but they're maybe not engaged enough to know how they can apply it to their own work. So largely working with the health sector, there was a call and a desire to have evidence and opportunities to work together and design spaces that would promote health and have a green focus. And similarly, the environmental sector knew that their work was contributing to people's health, but needed that evidence and opportunity to cross over. So what we're looking at is inclusive green spaces that support physical activity and health and well-being, an opportunity for stakeholder engagement. There's a real appetite for at the minute, so it's providing a forum for that. And then green spaces that both reduce inequalities and allow the co-design and the voice of community engagement to be involved in that. Our work with older people has largely extended the healthy places aspect of our work. So it's analysing the built environment and see how that is such a contributor to older people remain active, socially engaged and contributing to society. And we have worked for a number of years collecting information through community engagement with older people, ensuring that the voice of older people is incorporated into planning. And it's largely based on WHO's guide for essential features of age-friendly cities, which really are a guide for all of us. If we make a city that it is accessible for older people, it's accessible for anyone with mobility issues, anyone in a wheelchair, anyone with a pram. So it's really having those universal standards that everyone can access the built environment, and particularly in local communities where older people spend most of their time, and it is a key factor in negotiating those spaces. Through the Healthy Cities Network, we've been engaged in a policy information document that has just been launched to share the learning experiences of 12 cities across the network and how they have adapted during COVID to support older people and create age-friendly environments. And all the work in Belfast is led through the Age-Friendly Belfast Plan and the Healthy Aging Strategic Partnership, with key priorities going forward that will look at infrastructure, social inclusion, health and well-being, and financial security. So the themes are identified through consultation with older people and to find out exactly where the priorities are and where people need support. I suppose in terms of partnership working, the opportunities to work across Belfast and input into the development and delivery of research projects is where our partners come in. And we've worked closely with Queen's University for a number of years on a variety of projects, but the SPACE project looks at supportive environments for physical and social activity, healthy aging and cognitive health. And I suppose it's really to think about the links between the built environment, our lifestyle factors, but also biogenetics, and how they come together in urban environments with environmental exposures and the impact that that has on people's health. So it's thinking about the provision of supportive urban environments. So it's both the built environment, natural environment, and opportunities for social engagement, and how that can prevent or delay the progress of cognitive decline and dementia. And looking at the design of the urban environment, air pollution, noise pollution, and how these factors all contribute to people's physical and social activity, their health and their well-being. So the approach was taken that was looking both at the urban design and opportunities to engage older people. So there's a program of work looking at the participatory group modeling. So it's a systems-based modelling, which will look at all the contributing factors. It is also supported, there are 5 work packages in total, so it's looking at the spatial and environmental data that's available, so linking in with the longitudinal study for ageing in Northern Ireland and a cohort of older people that are engaged in it, analysing the data that they currently contribute, but also working with a group of older people to use GIS mapping on their day-to-day daily behaviours, their lifestyle decisions, whether they walk or if they use active travel, public transport, how they move within their local area, and also then their daily habits, which will inform the research findings. What we are looking at is then other possible pathways of understanding how the built environment influences people's choices, but also determines and contributes to their health and well-being as well. And what are the biological responses to the urban environment, and are there links between already existing inequalities and inform how people travel within their neighbourhoods. There's also work with citizens' juries, so it's a concept that we're currently employing as well, to look at how we sense check the findings and the emergent issues that are coming from the research, and also to get the voice of older people in the development of the research, but also the promotion of the findings to inform policy and planning across Belfast, the UK, and then the wider Healthy Cities network. So essentially our role within that is to support stakeholder engagement, but also share those findings right across Europe. We see that the Healthy Cities network, the population is aging, and we are all essentially dealing with the same issues, and how that can support and contribute to the development of older people's lives as we live longer, to ensure that we live better right across our lives. Other work that's happening in Belfast and linked to coincidentally the work that Juliet mentioned, we recently this past weekend had a citizens jury on car dependency. So asking a representative group of the population, how do we solve this issue? Very encouraging that a lot of people were saying the same things, and really from the recommendations, how do we use that to shape and change our city centre living and our opportunities for active travel and reducing our dependency on the car at the minute. And another piece of work that we're engaged in with Queen's University is Groundswell, which looks at green and blue space and the link between health and well-being and inequalities within that. So producing very high-level sophisticated data that will inform the planning of our green and blue spaces and how we can maximise the use and engagement of that for health and well-being. And I suppose just to finish, it's really reiterating what the regional director for WHO, and really at the core of all this is the sense that we should leave no one behind. So that's leave no country behind, leave no individual behind, and ensuring that those that are most vulnerable to change are at the core of what we do. So ensuring that we take an inequalities lens on the work that we're doing, and also to support ageing populations as we deliver and develop policies. Thank you. I provided information in the chat, links to further work of the SPACE project and information that I mentioned. And as the findings become available, I'm happy to share them with the network. Thank you.
And thank you ever so. That again, a fantastic presentation. You've covered so much. And interestingly, I was hot-footing it this afternoon back, having been at the Healthy City Design Conference in London this morning, where issues around how to measure stress in relation to a lot of those sort of key characteristics that you highlighted, and what the impact of people feeling stressed in those environments in terms of walkability, in terms of air pollution, and the impact on those elements of life as well. So some interesting work coming from Hong Kong and Kingston and in London and places like that. So I'm sure we can make those connections with you as well, okay?
Thank you.
So without further ado, we're going to move on. And Heather, thanks very much for your patience. Please don't worry about the time. We finish at about 15:15 or so, thereabouts. We may run over by 5 minutes or so, but I know that people are still with us. I think we've only lost one or two. So Heather, really looking forward to hearing not about neighbourhoods, but peoplehoods.
Thank you very much, Jeremy. Yeah, my name's Heather Duncan. I am the programme lead for Peoplehood. So I will just share my screen. So yeah, as Jeremy introduced me there, welcome to Peoplehood, our UKRI funded programme. So as you've already heard today, we are an ageing society. A third of children born today will live to 100. And by 2050, the number of people aged 85 and older is projected to double in size. Well, this is great news in terms of longevity. It doesn't necessarily mean that those latter years are going to be spent in good health. So to that end, UKRI created the Industrial Strategy Challenge Fund of 98 million to attract a wide range of bidders to attack this challenge. The Trailblazer programme are major collaborative programmes which look to tackle these across UK to help people experiencing poor quality older age. So some of the other trailblazers in the programme are Business Health Matters in Lancashire, which is looking at workplace health, Healthy Homes, Healthy Lives, which is London Rebuilding Society, which is looking to tackle adequate housing within London and making it fit for purpose for people as they age. Homes for Living, which is an Aon-led project, looking at home adaptations and more adapting houses for net zero. And Tribe, which is a digital platform to match carers with those requiring care. Given the news today, that it's a particularly welcome one, but yeah, they've still not found a way to clone carers yet. So I think that's still going to be an ongoing challenge for them. There's many other programmes across the UK, including Space that you've just heard about. So there's a lot going on within the funding challenge. Just to give you a bit of background about Blackwood, for those of you that are less familiar, Blackwood Housing and Care was created in 1972 by Dr. Margaret Blackwood. Blackwood has always been for accessible housing predominantly, and the rights of people with a disability to have suitable housing. So Blackwood has grown over the years and now has just under 1,600 properties spread across Scotland. Investing in innovation is what sets Blackwood apart from other specialist housing providers. Blackwood is well placed to test out some place-based design which supports independent living. Peoplehood is our 3-year programme operating across 3 Scottish neighbourhoods to help residents live healthier for longer. It's led by Blackwood Homes and Care and supported by 9 partners from industry and academia, and we're targeting citizens to live an additional healthy 5 years. So that's about quality over quantity. We will do this by removing barriers that people are experiencing to give them a step up to healthy ageing. Our programme is designed to create a range of opportunities in a neighbourhood so that individuals can take part in many activities or only a few. The range of the programme means that there's something for everyone and that no one should be left behind. We will achieve this through co-designing and co-creating with our engaged participants across a range of themes. Measuring progress of individuals throughout the programme will help us evidence the success. We've selected 3 demonstrator neighbourhoods where Blackwood has housing and in some cases care services. So Buckie, I'm not sure how many of you will be familiar with Buckie up in Murray. I wasn't until I got involved in this project, certainly. It's a rural coastal town where Blackwood has a small housing development. Buckie has a less diverse population with a higher proportion of pensioners in line with many coastal towns. The most significant concerns from residents there were staying in their own home for longer, transport and youth disturbances. Cardonald, we have a care home, we have care at home, and we have quite a lot of housing as well. It's despite the slightly dodgy geography on the map here, it's on the south side of Glasgow, and it has our largest mix of residents in terms of age, health, wealth and culture. It's also on the SIMD index, the multiple deprivation index within Scotland. Some of the concerns raised locally within this neighbourhood include safety and security, and reduction of council-run programmes. It also has our largest proportion of non-native English speakers, so that's necessitated a different approach to engagement. Charleston over in Dundee, we're building 66 new homes and we already have 110 houses there. We also deliver care at home. It's a semi-urban area of predominantly social housing in the northwest of Dundee. Poor quality pavements and roads and not being particularly well connected to the city centre makes it feel more isolated than it should be. It's also on the SIMD index. Some of the concerns locally there include lack of investment, safety and security, and a generational divide. It's also where Blackwood, we have our largest footprint there, and it's got the greatest potential. Given that we're just about to develop 66 new homes, we're also looking at some of the green space around those homes and creating a golf course. We've agreed on these 3 areas to give a mix of rural and urban locations to test different parts of the programme and how they'd work in different environments. Here's a list of some of the activities currently running across the neighbourhoods. We're working closely with local groups to support signposting of activities in both directions. So for example, Glasgow Life, which is the Leisure Trust in Glasgow, we now have access to their access scheme, which gives eligible people 6 weeks of free access to the gyms and the swimming pools across the city, and then a year subsidised. Southside Housing Association, we've been working with them and using their community flat and their outdoor park as well for some of our events. And we've also been working with other groups across the other 2 areas. So as you saw from one of the earlier slides, UKRI specified 7 themes which each potential bidder should select 5 of. We selected these 5. So we'll look at place. Do their homes meet their needs, or are they unsuitable? What could be done to avoid moving house? How can changes in the home help people to maintain their independence? And do they have access to suitable outdoor space? We'll look at technology. We're providing tablets, connectivity and training to help members become more comfortable with using technology. We'll also look at integrating some of that technology into the home, such as alert systems, to give as much independence to each person as is safe and practical. We will look at the people element. We'll use a range of platforms to help people involved in the project connect with their communities, such as in-person volunteering, interacting through our My Life app that we're developing, and online social groups. We will look at access to physical activity. So we're working with local groups to create a series of activity programmes without barriers to entry. For example, cycle clubs, where we will provide the equipment, the training and set up sessions. We will run taster sessions to try out new sports, and also activity by stealth, such as gardening groups. The programme officially started on the 1st of April last year, and it runs till the 31st of March 2024. So we're at the halfway point now. We really struggled with engagement in year 1 of the programme due to COVID restrictions changing fairly regularly. We embarked on a series of summer events, which included, you can see some of the pictures here, which included food trucks, live music and entertainment. This helped us reach over 500 members signed up, as well as giving the neighbourhood a great day of fun and a chance to connect with us as a project and each other. The events were successful and attracted nearly 300 new participants. Now I'll take you through some of the individual projects within the 5 themes of healthy ageing. Our first healthy ageing theme is designing for age-friendly homes. It's our bread and butter at Blackwood. This is what we're known for within Scotland. In one of our neighbourhoods, Charleston, as I mentioned, we'll be building new homes, so it gives us a real opportunity to be able to put some technology within those homes to help people live more independently. We will also look at how we can support homeowners to reimagine their homes to make it fit for use as their needs change. Within our programme, retrofitting is not particularly focused on oh, sorry, skipped a slide there. It's not going to focus entirely on energy efficiency. It's going to be focused more on helping people be able to stay in their homes with any physical disabilities or mobility needs. But it may be something that we look at in the future as net zero is becoming more important. Supporting social connections is about helping communities connect. Working across a range of areas and with residents' input, we can make things happen. This could be exchanging skills using the value exchange model, putting on classes, to help residents get online or providing volunteering opportunities. Here is one of our co-design sessions where we're developing our My Life app. We brought together games designers and local residents and stakeholders to discuss what they would like to see and not like to see within the app. At Peoplehood, we want to help residents get out and about and doing the activities that they love. We will complement, not replicate, what's already going on in the neighbourhood so that everyone can benefit. Together, we can try new things, create groups and friendly competition to help people live healthier for longer. Enterprise, one of our partners, will provide electric cars to each of the neighbourhoods. So it's quite interesting to hear about some of the car dependency discussion from earlier, because some of the areas that we're working on, particularly Charleston, it doesn't have a lot of free space. There's a lot of cars parked on one side of the road. It can make it quite dangerous. There isn't enough space for everyone to have a car. So car clubs could potentially be part of the answer to that community driven assets. So we will also have electric bikes available in each of the neighbourhoods, and we'll work with residents to make the outdoor environment accessible and attractive to all, to encourage more social interaction and physical activity. This may include outdoor gyms, covered seating areas, depending on what people would like. We'll also provide libraries of equipment to complement what's already in place, such as small hand tools for gardening, home exercise equipment, or low-value occupational therapy equipment. The last theme is managing common complaints of ageing. The Lifestyle Alerts project supports residents by analysing energy usage data in homes to recognise patterns and behaviours to spot when intervention may be helpful. This will use AI and machine learning and will help shape the future of care by minimising the impact of an acute event like a fall or early detection of decline. This will allow those individuals to maintain their independence for longer, which aligns with Blackwood's mission. Along similar lines, we are looking to pilot our digital responder care service in the 3 neighbourhoods. At Blackwood, we are supporting independent living by making life easier, happier and healthier. The aims and objectives of each of the projects within aligns closely with some of the recommendations made in the What Creates Healthy Cities report. We will complete the evaluation of the programme by the end of September 2024, which we expect will show that this combination of products and services within a place-based environment will give residents 5 more healthy years and will add to the body of evidence to inform future government policy and funding. Thank you.
I was just sorry about that. I was just taking my time to unmute myself. So thank you, Heather. That was really great. And it also wove really nicely into what Anne's been talking about, all presenters. And you've covered, again, a hell of a lot. I'm going to just say that we've got several questions in the chat box, and I will go through them in a minute. But I do think we've covered a hell of a lot, and one of the benefits of the Learning Network is our ability to share information. And I know Sally's been posting quite a lot of links up in the chat box, and please do feel free, anybody who's contributed this afternoon, to add further links. But I'm going to say we've got about 10 minutes or so to go through the questions, and they sort of compile neatly into ones that may be around planning, and some which are targeted at you, Richard, Lord Best, and others which are much more around either the report and the toolkit, and a bit again more general around the UKRI project. So if we could sort of kick off with Sue, and good afternoon, Sue. Really nice that you could join with us. Sue's written several blogs for the LIN over the years. Lord Best, in getting the planning system on board, how do we overcome NIMBYism to ensure that housing is built in adequate numbers and at speed, including housing for older people?
Right, in a sentence, the dreadful NIMBYs. Well, retirement housing doesn't do too badly in terms of local protests, because this is not going to produce a lot of noise. It's not going to produce a lot of traffic. Older people are going to be good neighbours. They're not going to clutter up the roads. They're not going to cause a lot of mischief. So to some extent, we're onto better, easier ground. But the big picture still remains that in a lot of the UK, nobody wants anything built next door to them, and you can consult and talk as long as you like. They don't want the homes built next to them, and it's an uphill struggle to get there. Government, the latest proposals from our new Prime Minister are to do with giving more power to the local level, and in a way that is pretty difficult. It's very difficult for local councillors to stand up against the opposition locally. Devolution, of course, is a great idea, but devolving to the most local level is pretty difficult when it comes to securing consent from the local population. It's not the local population that you're building for necessarily, the immediate people living next door. It's a wider community, and we have to serve the interests of the wider community and not listen only to those who are next door. And of course, don't want the disruption, the lorries coming and going, builders on site. They don't want it. And what we've been trying to overcome that by moving the decision making up the line a bit. Mayors, combined authorities taking bigger decisions at a further back stage. Maybe things will get a bit more difficult, not a lot easier if some of these new ideas. We're going to get a new planning bill. Government has announced, as well as the levelling up has got quite a bit of mostly rather good stuff on planning. We're going to get a planning bill. Is it going to make life more difficult? Is it going to be a bit softer on the affordable housing requirements of the house builders? We don't want that. We're desperate for the affordable housing. We mustn't give in now and accept a worse deal on the grounds that it's not viable anymore. Costs have risen to do this affordable housing. No, we need to take back control, and the community at large needs to be making the decisions, not the people who live next door, and not the house builders who have other motives other than for the good of the community at large.
So Richard, you raised some of the challenges at a local level, how to sort of look at a combined authority, and someone like Greater Manchester has published its tripartite agreement around integrating health housing. It's also got a spatial plan for ageing as well as part of its overall planning. Ian here from Ian, I think Tetlow King, so great to see you. Is the new task force going to be able to build on the great work of the likes of your APPG, ARCO and the LIN to argue for reform of the planning system to improve the delivery? This is more about specialist housing than perhaps mainstream housing, which is age friendly.
Quite. Well, the government's task force on older people's housing, brackets and care, this has been a golden hope for us. If anybody wants to know what the APPG is submitting to this task force, get yourself invited, please. You're all welcome to the next meeting of our APPG. If you need our email address to get an invite from the APPG, you're all welcome to come online as well as in person. Jeremy, perhaps you could be the broker there. If people could ask you, probably easiest for that contact point. We can give you our submission. But will the task force go ahead now? We've been waiting for this task force. It was announced by one of the housing ministers, one called Chris Pincher, blessed memory. But Chris Pincher has left us, and we've had 3 more housing ministers since he announced it at an APPG meeting that we're going to have this task force. It's a great idea. It's a really good thing. You need to get people together, get your strategy organized. But does it sound like something that might lead to more spending? That's not very fashionable. Does it sound like something that will lead to more regulation? That's not very fashionable. More taxation will be required. That's not very fashionable. So I'm a bit nervous about the task force, but I'm still hoping that it'll go ahead and make a difference and be useful.
Yeah, I concur with that, and also I think wanting just to sort of coming back to the supply side, I know that ARCO have been working with the business school in Oxford to see about to draw on those sort of numbers that you talked about, about scalability to, I think they're sort of saying we need 1 million new age-friendly homes by 2040. And Jan here in the questions asked, there's also concern about the development of viability challenges. We could then also see the decrease in the delivery of affordable housing. Any thoughts on that, any of you?
We let colleagues say something.
Juliet, did anything come through your commission that you and the evidence that you pulled through around viability?
It's not an area that came up in the evidence, but I think, I mean, my gut reaction is that, you know, it's only going to make things worse in terms of delivery of affordable housing. And I think that's the only, you know, evidence would suggest that developers use any argument they can to decrease their contributions, be it in affordable housing or through Section 106. And I think, you know, it would suggest that affordable housing will decrease. I think that would be my gut reaction.
And may this be also the same in Scotland, Heather, and Northern Ireland, Anne?
Yeah, I suspect we're quite fortunate in Scotland that social housing has probably a slightly greater foothold. We are able to benefit from grants to build affordable housing. It doesn't quite cover the cost of affordable housing with perhaps greener energy options. So we're still stuck at the moment with putting gas boilers in, for example. That's not been resolved, but it's definitely on the agenda for future discussions. But yeah, definitely receiving sort of 50% grant towards the costs makes a big difference in how viable development is.
Mm-hmm.
Let me move on because we've got a few more minutes. And David, who's joined us, David's got a couple of questions, and great to have you here, David, from my neck of the woods out down in Gloucestershire way, if I remember rightly. Juliet, how do you feel the government's focus of growth and dereg dovetails with your findings, and what impact will that have on taking your findings forward, do you think?
Well, that's an interesting question, and certainly when we presented to DLUP, to the Department for Levelling Up, it was the day after Liz Truss actually became Prime Minister, and so that was very much at the forefront of people's minds, and that was one of the questions we were asked at that webinar. And I think what we come back and say is actually a healthy workforce is a more productive workforce, and you know, if you have people who are off sick less, have less mental health issues, there's going to be a more productive workforce, and that will, you know, lead to growth. So I mean, that's one answer, but there are other aspects as well. There's for example, housing, you know, a big house building program, affordable housing and retrofitting program can create jobs. I mean, it can encourage other private investment and encourage economic activity. So again, I think there are links, strong links with the growth agenda. And then similarly in transport, there's if you take private cars off the road, there's less congestion, you know, the economy and, you know, the transport system works more efficiently, and, you know, that leads to growth. And then if you think about the 15-minute neighbourhood, you know, 15-minute city, that has been shown to stimulate local economies, and again, you know, drive growth and prosperity. So, you know, I think there are lots of good arguments for supporting health and well-being that also contribute to the potential for growth. So that would be my answer. Yeah.
Excellent. And again, do have a look at Lord Crisp's book as well around the links between health and housing and growth. And he's a fellow peer, I think, with you, Richard. One of the other questions that's been raised by an anonymous attendee who could be a civil servant or whoever, but anyway, welcome, is around this interest about the comparison made between health impacts in urban and versus rural areas. Is this covered in the toolkit, Juliet? And also, if I can ask Richard if he could reflect back on the rural housing and older persons paper we did. I remember you and I visited several sort of almshouses and the like in North Yorkshire. So, Juliet, first about the toolkit element about urban v rural.
Yes, certainly. And in fact, the toolkit, we had specific searches, and if you go onto the Commission website, you can read the more technical side of how we searched and what search terms we use. And we were very much focused on cities. So it was what creates healthy cities as opposed to rural areas. And so there wasn't much evidence that came through our work on urban rural differences. So that's not to say that, you know, health in rural areas and some of these sort of health inequalities aspects are very pertinent, you know, related to housing in particular, or transport and the lack of, you know, public transport options, and, you know, all sorts of issues. I think the issues that we came across also ring very true in rural areas. So I mean that's perhaps the next commission, what creates healthy rural areas.
Richard, any thoughts on that?
Yeah, well, you know, we picked up on the fact that delivering care to rural areas means long journeys for care workers. This ghastly thing of care workers not being paid for journey time, absolutely disgraceful. But people strung out over a wide area makes it much more difficult to provide economically, to provide the care that people need. This means that adult services departments rather like the idea of people moving to the nearest town and being together in a extra care scheme for 60, 70 people, where care can be delivered quite easily, and it's already within the town. And there are a lot of economies of scale that come from that new build. The trouble is, a lot of people in rural areas don't want to move to the town. Those that have been there living in the countryside, in a rural community for their entire lives, it can be pretty disruptive to move to the local town. And we advocated at least as much priority going to building those 6 bungalows on the edge of the village, where people are still absolutely embedded in the same community. Their relations who bring them lunch every day can still do it. Those little schemes can make a huge difference to a rural community.
And Heather and Anne, have you got any experience of that sort of comparison between rural and urban? I mean, Heather, I think you touched on the variety of locations you operate in.
Yeah, we've had different challenges early on in connecting with some of the rural communities. So we had to work much closer with some of the local groups there to almost have them advocate some of the suggestions that we were having. That seems to be working quite well, and having a presence at a lot of the local events seems to be getting people more aware of what we're doing and more willing to listen than it has been in urban environments. But yeah, the proof is in the pudding probably towards the end of the programme to see which actual parts of the programme work better than others in different geographical areas.
And Anne, any thoughts? I'm conscious we've been hogging the Q&A and we haven't given you a chance.
No, you're fine. Thank you. Belfast, I suppose, we work predominantly in Belfast, although a third of it would be considered rural, just with the hills in the surrounding area in terms of green space and availability. But again, it's that access to it, like everything else, access to healthcare, access to the local built environment. Outside of Belfast, yet Northern Ireland would be predominantly rural. We have other cities and towns, but we would largely have issues around that kind of discourse between access, certainly to all things that determine health, so education, employment, health care services as well, and certainly the concentration of housing. But I think it's that focus of putting health and well-being at the core, and building for our, and I don't mean physically building housing, but building a society that cares for our aging population, and how we enable people as we age to still be able to contribute to society as well, and remain active and engaged, and how we enable that. So.
Oh, well, thanks for that. Can I just go round? Are there any other final comments and observations that you've had from this afternoon's happy hour? Juliet, to start off with you, my top left of the screen.
I suppose what I've been struck with is how well all the presentations really knitted together, and you know, there's a real, I think, body of evidence here that, you know, health and well-being is so critical for our cities, and you know, it's really heartening to hear from practitioners echoing the information and the evidence that we found from an academic perspective. So yeah, really fascinating afternoon. Thanks.
That's been great thread. And Anne?
Yeah, just echoing what Juliet has said. I think how the work and the presentations all align, but also welcoming the Commission's report, and to have a toolkit available which is putting into action the steps and the areas that you should focus on. I think that is always really valuable. So it'll certainly make the voices louder for a collective approach to taking forward the issues. So thank you.
Heather?
Thank you. Yeah, nothing really to add to Anne and Juliet's comments. To echo the same points there. It's great if everyone's saying the same thing independently. Then that's got to be quite a powerful quite powerful status. So thank you for inviting me.
It's been delighted to have you. And Richard.
Well, that was really great, Anne and Heather's presentations. I really enjoyed those. Thank you very much for those. It isn't all gloom and despondency, because there are a few things kind of on the horizon that are helpful. The levelling up agenda hasn't gone away. We've got this levelling up and regeneration bill. It comes to the Lords at the end of October, but it's going to throw quite a lot of extra resources at improving conditions, improving places that have been left behind. So we've got to make the most of that and try and use that opportunity, I think, creatively. But, yeah, we're hoping the task force will also come along now, and that'll galvanise some ministerial action. So fingers crossed. It's in some ways this is an important and good moment, I think, for those who are interested in retirement housing, not least because things have got to such a bad state in terms of the health service, in terms of the need to prevent people getting ill, having the stresses and strains that bad housing and bad environments can create. It's got so bad, the health service so needs support further down the line. The government is, I think, forced to listen. So we may make progress despite all.
Well, I think my glass is half full like yours, Richard, and that's probably quite a good analogy, actually, come to think of it, for a happy hour. But thanks all of you for fantastic presentations. I've really learnt a lot. For those of you watching who haven't joined us, we run happy hours. We try and do them on a weekly basis. And next week we're joined by Levitt Bernstein Architects and also David Birkbeck from Design for Homes, who actually helped coordinate the first HAPPI report. And he's going to talk about the recent HAPPI Award and the work that he's done around building for a healthy life, one of the toolkits around for the upbuilt environment. And Levitt Bernstein are going to talk about their recent HAPPI Award they got for a passive house scheme in London, and a commendation for another one in Preston. So some of those sort of sustainability issues, Heather, that you touched on in particular, we'll be looking at that in a bit more detail next week. But on behalf of all of us at the HousingLIN, can I thank you for contributing? Can I thank Sally and the team behind the scenes for putting on today's session? And David, if you're still with us, can I also wish you well and a speedy recovery. Look forward to seeing you at the next session, and thanks everybody. And the slides and the recording and the PowerPoints will all be available, we hope, tomorrow. So do join us again. Thank you.
Thank you.